And we see the need for this sort of healthcare within the system so that people can unlock their own wellness. We could empower you with information, with science, with top-notch information. We can empower you with supplements. You can make your own decisions as to what you want. We're not trying to profit from the public sickness. No, we are trying to arm the population with information so they can make their own decisions, because we are teaming up with exceptional doctors, formulating very exceptional treatments and offering a range of products that the public could be assured could give them some sort of support right now.
Tamara Ugolini here with Rebel News to highlight how many Canadians are disgruntled with the failing healthcare system plaguing individual provinces and territories, as evidenced by recent polling that showed less than half of Canadians are satisfied with publicly funded healthcare, which is why companies have started to fill the gaps in this crumbling system. And the one that I'm featuring today is the Wellness Company, founded and chaired by entrepreneur Foster Colson, who says that the company was born from oppressive government health policies, of which I would say those especially seen during the COVID era, many still persist today. And he says a lack of appreciation for natural approaches to cure illnesses. It's a way to break free from Big Pharma. The Wellness Company, or TWC, began in the United States and has recently expanded into Canada. Joining me now to discuss this endeavor and to share additional insights into this company is Chief Scientific Advisor for the TWC, Dr. Paul Elias Alexander.
I worked for the Infectious Diseases Society of America from 2017 to 2019, helping them build their clinical guidelines for doctors and surgeons, etc. Around that time, I worked WHO in Geneva, World Health, and Pan American Health in Washington, asked me to work with them and consult. Because COVID emerged in January 2020, they changed my role to be a COVID consultant to WHO and Pan American Health. And around April, May of 2020, the Trump administration asked me to join as a senior pandemic advisor working out of Washington, D.C. in Health and Human Services. So that's what I was doing. I left in October of 2020, just before the elections, and since then I joined the fight. I was against the lockdowns entirely, and I questioned the vaccines across the board for not just elderly, but particularly in children, because children were at zero risk of severe illness or death, and the vaccines were not safety tested. They should have never been rolled out, period. It's not even a matter of, well, if it was safety tested. They were not needed, and COVID has taught me something. You know, I was not the kind of skeptic I should have been in terms of vaccines fully. Today, COVID taught me that we have to question these vaccine makers and the healthcare officials. And I actually think that most of the vaccines that we've given our kids, most of the vaccines we've taken up were never needed. And this is more about money, greed, power, and they've harmed us. Wellness Company is led by the CEO, Foster Colson, out of British Columbia, and he started Wellness Company America, USA, and now we've just initiated Wellness Company Canada, and we are talking about Wellness Company Caribbean. It's really embracing your health and lifestyle changes, but the focus is on proper supplements, some telehealth, but really putting your health and well-being back into your own hands personally, and with a key focus on prevention, preemptive, not reactionary healthcare. So we are talking about improving your lifestyle, to making decisions, and to do that, people need to be armed with top-notch, high-quality, trustworthy information. So we are doing that. We are putting out a lot of newsletters, a lot of medical information and data, and it's really a one-stop shop for preventive, almost tailored healthcare instead of reactionary, and giving you, the person, the Canadian, the American, but right now we are focused on Canada, the autonomy and education for your own informed decision making, and that's the key.
It seems really like it's about empowering the individual to take their health into their own hands. And what I hear about health all the time is either you pay now or you pay later. And so either way you pay. So you focus on your health now or you don't, then you'll end up paying for it later. Can you tell us a little bit about the nutraceuticals that are kind of the cornerstone of the wellness company?
Well, the nutraceuticals are the cornerstone because, in a way, the model that we are using is we are trying to create this one stop where you have telehealth, and eventually we want to have a few brick and mortar shops, stores, so to speak, that if you needed to get the additional testing or the additional follow up, second opinion support, even specialized care, we can funnel, we can get you there, and we could also offer that. So we're really trying to revolutionize healthcare because COVID showed us the gaps, showed us where they locked the doctors down, they locked the hospitals down, they closed everything and made everything COVID beds. So there were people with cardiovascular illness and diabetes, cancers, etc., who could not even get care. And after 3 years, now they are very advanced in their disease pathology. And many of them are dying now. And we are actually logging, seeing those deaths emerge in excess mortality. We've lost a lot of people due to the lockdowns itself and school closures. But we've lost a lot of people, the excess mortality due to people could not get care. And also how they were managing the healthcare with the sedation and the remdesivir and the ventilation, etc. But that inability to get proper care, doctors would not entertain their patients properly, they would not give them medical exemptions. Doctors helped force the lockdowns, force the vaccine mandates when there was no science or data to support. We are saying stop. Canadians or Americans or anyone, you need to get back that autonomy to be fully informed. So when you deal with the healthcare system, you actually know almost what's wrong with you, and you are not just going there as we did before, sitting down in the doctor's office, just waiting for the doctor to tell you. Often the doctor was almost wrong. Most often, Tamara, that we knew that in life, often when you went to the doctor, you just needed a doctor to be very honest with you and say, look, your life is stressful, it's a challenge. You might just need 2 weeks of a break or to tone things down or examine your life, examine your lifestyle. What are the stresses in your life? But we don't need to medicalize you. We don't need to put you in a hospital. We don't need to put you on psychotropic drugs. It's all up to you and your own perspective and a healthier life. And that's where we're coming from with the wellness company. And we have this range of nutraceuticals. One of them is key. We have the wellness company Healthy Heart. We have for diabetes control, etc. One of them right now is spike recovery, spike detoxification. And why is that important? Because right now people are coming at us constantly whenever I speak on stage or Dr. McCullough, and they say, look, I've taken the shot, or I got COVID, the virus, and I know the spike protein is still in me. They're reading. People are very critical thinkers, the public, and they understand. So you have the spike protein from the virus or from the vaccine that is in them. And we have the research that shows that it does not dissolve, as the CDC and Health Canada even told us. That was a blatant, misleading statement. And we have the spike protein, especially from the vaccine, in us long term. We have preliminary science that is showing us that substances such as nattokinase, which is a natural fibrinolytic drug, which is a blood thinning drug, it dissolves the spike protein. So that's good news. The science is maturing, it's evolving, and the wellness company employed some pharmacists and scientists to put together a formula that contains this nattokinase. It was always available, natural blood thinner, and offer it as some sort of support because people need help today. Of course, we are trying to organize the proper long-term clinical trials, large sample size, proper duration, etc. But that takes time. In the meantime, we are trying to offer nutraceutical support to people to support their heart health, to support their immune function, just to support their lifestyles as they move forward now, armed with much more information and a much more critical thinking public. COVID has shown that the public is capable of listening, thinking, reading, and making informed decisions, especially due to the rebel news. People like you who've kept people on top of the issues and the science.
Thank you for that. Now, I wanted to get into, because it seems like in our healthcare system, at least in Canada, your family doctor, your family physician is really the gatekeeper to the entire system. Now, the wellness company has various levels of memberships. Can you speak a little bit about what those memberships are and what people could expect to receive from them?
Well, I think the issue is that with these memberships, what we are seeing is we are trying to offer people the opportunity to pay some sort of membership fee, and you could get access to different levels of the telehealth services or the healthcare, the nutraceuticals. And the reality about it is that we are offering what we call access to uncensored content, the ability to schedule the basic package, virtual appointments with trusted doctors, doctors who really are not afraid to follow, their own design protocols catered to you. You get access to the internet pharmacy, the supplements delivered to you, etc. Vaccine exempt letters, whole host of supplements, and the truth about it is that depending on the package that you engaging, you will have access to the medical doctors online. You would have access to the nutraceuticals. I believe in the packages, the nutraceuticals are part of the package, so you get nutraceuticals sent to you based on your decision making, which ones do you require. Well, I believe right now we're exploring packages that we can reduce the price and make it much more affordable and accessible, and we're exploring ways also that maybe people can get tax breaks for using these, for signing up for the subscription, etc. So I think there's a lot of good news coming. We launched last week in Canada, and we are supporting it. We are endorsing it because we recognize the gap and we see the need for this sort of healthcare within the system so that people can unlock their own wellness. We could empower you with information, with science, with top-notch information. We can empower you with supplements. You can make your own decisions as to what you want. We're not trying to profit from the public sickness. No, we are trying to arm the population with information so they can make their own decisions, because we are teaming up with exceptional doctors, formulating very exceptional treatments and offering a range of products that the public could be assured could give them some sort of support right now.
And if people wanted to find out more, to learn more about you, where can I direct them?
In terms of me, I run my daily blog, which is a Substack, and it's called Alexander COVID News. That is ALEXANDER space COVID space news. Look, I offer the blog for free, and I have no restrictions. There could be a $29 yearly fee. I mean, if you want to support me, you can pay the $29 yearly fee. If not, you could just remain as a free subscriber. There's no difference. I don't constrain what a free gets versus paid. The paid does help me because I am one of those scientists who were cancelled and lost my income because I stood up against the lockdowns and the vaccines. I also wrote this book. It's called, well, I'm making sure it's not upside down, Presidential Takedown. As you know, I worked in the Trump administration for President Trump. I'm not getting into politics as to who I supported, who I didn't. I was hired as a scientist at Health and Human Services, and I worked in this administration. I wrote this book. It just gave my inside view as to what happened with the elections, because at the end of the day, President Trump was actually going to win the re-elections because we had the internal polls. But something happened across time, and many people discuss, votes were stolen and tampered with. I give a different view. I'm not discounting that. Historians and courts and whatever will figure that out. I am talking about what I saw in terms of subverting the pandemic response, subverting him, which damaged the pandemic response. And it's a very important piece. And, if you want, please take a look at my book, Presidential Takedown.
All right. Thanks for joining me, Dr. Alexander, and I'm sure we'll touch base again soon.
Thank you very much, Tamara.
The wellness company not only stands for true informed consent, but they give refuge to physicians that took a moral and ethical stand throughout the disastrous public health response of the last 3 years. With the pivot to online, many Canadians are concerned about how their data is being used, but TWC uses a third-party EHR, that's electronic health record system, called CHARM, that uses encrypted communication software and security processes. Is this the future of healthcare, born from medical apartheid and a pharma-captured system? For Rebel News, I'm Tamara Ugolini. We created a special website at stopmedicalsilencing.com for instances where medical professionals and other credentialed experts were silenced, slandered, or otherwise smeared for dissenting against the COVID regime. If you agree that professionals should be able to give their professional opinion without fear of reprimand or professional punishment, then consider signing our petition at stopmedicalsilencing.com. And while you're there, you can check out our previous reports.